Hello and welcome. Today we're delving into a neurological condition called Tourette syndrome, a disorder that affects the brain and nerves, causing repetitive involuntary movements or vocalizations known as tics. Join us as we explore the causes, symptoms, diagnosis, and management of this complex condition. While the exact cause of Tourette syndrome remains elusive, researchers believe it's a complex interplay of genetic and environmental factors. Genes inherited from parents play a significant role in predisposition. However, not everyone with these genes develops Tourette's, suggesting that other factors are involved. Research has looked into possible connections with prenatal exposures, such as maternal stress or infections during pregnancy, but more research is still needed to fully understand these potential triggers. Ultimately, it's likely a combination of nature and nurture that contributes to the development of Tourette syndrome. The pathophysiology of Tourette syndrome involves abnormalities in specific brain regions, including the basal ganglia, thalamus, and cerebral cortex. These areas are crucial for controlling movement, and communication between them relies on neurotransmitters, primarily dopamine. In Tourette's, there's evidence of dysregulation in dopamine pathways, meaning dopamine levels may be either too high or too sensitive in certain brain areas. This imbalance is thought to disrupt the normal filtering and suppression of unwanted movements and vocalizations, leading to the tics characteristic of the syndrome. Other neurotransmitters such as serotonin and norepinephrine are also thought to play a role. Tourette syndrome affects people worldwide, across all ethnic and socioeconomic backgrounds. It's estimated that about 1% of school-aged children have Tourette syndrome or another tic disorder. The onset of tics typically occurs during childhood, usually between the ages of 5 and 10. Males are more likely to be affected than females, with a ratio of about 3 to 4 males for every female. While the condition is often lifelong, the severity of tics tends to decrease during adolescence and adulthood for many individuals. The hallmark of Tourette syndrome is the presence of tics, which can be either motor or phonic. Motor tics involve movements, and can range from simple tics like eye blinking, head jerking, or shoulder shrugging, to more complex tics like touching objects, jumping, or making specific gestures. Phonic tics involve sounds and can also be simple, such as throat clearing, sniffing, or grunting, or complex, such as repeating words or phrases, using obscene language, known as coprolalia, although this is less common than many people think, or repeating someone else's words, called echolalia. Tics can vary in frequency, intensity, and type over time. Many individuals with Tourette syndrome also experience premonitory urges, an uncomfortable sensation before a tic that is relieved by performing the tic. Furthermore, Tourette syndrome is often accompanied by other conditions, such as attention deficit hyperactivity disorder or ADHD, obsessive compulsive disorder or OCD, anxiety, and learning disabilities. Diagnosing Tourette syndrome involves a clinical evaluation by a qualified healthcare professional, typically a neurologist, psychiatrist, or pediatrician with expertise in movement disorders. There are no specific blood tests or brain scans that can definitively diagnose Tourette syndrome. Instead, the diagnosis is based on the diagnostic criteria established in the Diagnostic and Statistical Manual of Mental Disorders, or DSM. These criteria require the presence of both multiple motor tics and one or more phonic tics, with tics having persisted for more than 1 year and with the onset before the age of 18. It is also necessary to rule out other conditions that could cause similar symptoms, such as drug-induced tics or other neurological disorders. Tourette syndrome is not typically categorized into different types, but rather classified based on the severity and types of tics present. Tics are generally categorized as either simple or complex, as we discussed earlier. It's important to remember that Tourette syndrome is a spectrum disorder, meaning that symptoms can vary widely from person to person. Some individuals may have mild tics that are barely noticeable, while others may have more severe and debilitating tics that significantly impact their daily life. There's no cure for Tourette syndrome, so treatment focuses on managing tics and associated conditions to improve quality of life. Treatment approaches are individualized and may include behavioral therapies, medications, or a combination of both. Behavioral therapies, such as comprehensive behavioral intervention for tics, or CBIT, help individuals learn to manage their tics through awareness training, competing response training, and relaxation techniques. Medications such as dopamine blockers, alpha-adrenergic agonists, and botulinum toxin injections can help reduce the frequency and severity of tics, but they may have side effects that need to be carefully considered. Managing associated conditions, such as ADHD, OCD, or anxiety, is also an important part of treatment. Support groups and educational resources can provide valuable assistance for individuals with Tourette syndrome and their families. Because the exact cause of Tourette syndrome is unknown, there's no definitive way to prevent it. However, minimizing potential prenatal exposures, such as maternal stress or infections during pregnancy, may help reduce the risk. Early diagnosis and intervention can also help manage symptoms and improve outcomes. The prognosis for individuals with Tourette syndrome varies. While the condition is often lifelong, many people experience a decrease in the severity of their tics during adolescence and adulthood. With appropriate treatment and support, most individuals with Tourette syndrome can lead fulfilling and productive lives. Recent research is focused on identifying specific genes associated with Tourette syndrome, improving our understanding of the brain mechanisms involved, and developing more effective treatments. Deep brain stimulation, a surgical procedure that involves implanting electrodes in specific brain regions, is being explored as a potential treatment option for individuals with severe and treatment-resistant Tourette syndrome. Research is also investigating the potential role of the immune system in Tourette syndrome and exploring the use of immunomodulatory therapies. As our understanding of Tourette syndrome continues to grow, we can hope for even better treatments and outcomes in the future. Thank you for joining us on this exploration of Tourette syndrome.